Joining us now, former acting CDC director and president and CEO of the Robert Wood Johnson Foundation, Dr. Richard Besser. Really good to have you. If you were sitting on that Senate panel, Doctor, what would your question be to RFK Jr.?
Wow, it's hard to know where to begin. You went through a list of the things that he's done in terms of eliminating a quarter of CDC's staff. He came in wanting to focus with laser attention on chronic diseases, and then he eliminated the Office on Smoking and Health, and we know that smoking is the #1 preventable cause of chronic disease. So I'd ask him about those things. But I would also ask him if he directed his director of the CDC, Dr. Menarez, to fire her leadership team. And I'd want to know why, since they are all extremely talented civil servants, public health leaders who do not serve at will. They are civil servants. I would ask him whether he told Dr. Menarez that she had to agree to approve whatever recommendations came out of the advisory committee to the CDC on immunizations. There's great concern that the committee doesn't have the background, the expertise to make recommendations for the nation. And I would ask whether he told her she had to approve those. I spoke with Dr. Menarez before she was fired, and she said those were two things she would never do. She would never take her oath that she gave to support our nation, to protect our nation. She would never go back against that. And I would ask him whether he had directed her to do that. This is a secretary who came in with a very strong anti-vaccine agenda. He's one of our nation's leading anti-vaccine proponents. And he is moving forward very quickly to undermine the ability of our nation to protect itself from preventable diseases.
He has amassed quite a following of people who agree that they can't believe these agencies like the CDC, and they'll point to individual instances where they feel like they were misled about whether their healthy child needed the vaccine, or they'll say, my kid developed a peanut allergy because the American Academy of Pediatrics said don't let your kid touch peanuts until they're 2 years old, and that ended up developing allergies for kids all across the country. These agencies have made mistakes in the past. How do you rebuild? What do you say to Americans who point to the mistakes and say, why should I trust you now? Look, you got that other thing wrong.
Yeah, I mean, that is a great question. It is extremely hard to rebuild trust when you've lost it, especially when you have political leaders who see that there's great value in sowing the mistrust in that agency. I led CDC at the start of the H1N1 swine flu pandemic in 2009. And the difference there was that when we made changes and recommendations, the public were able to hear it from me. I could explain what we learned and why we changed the recommendations. During COVID, once CDC said this is something dangerous, something that you're going to have to take great care to prevent, the agency was not allowed to talk to the public. And so whenever there was new information learned that led to better recommendations and changed recommendations, they were lifted up as flip-flopping, not knowing what they were doing. It was the exact opposite what you'd want to see during a public health emergency.
So are you worried that somebody like RFK Jr. right now can do even more damage because of that drop in trust?
Well, he is sowing that mistrust, and it seems like he is being given free rein to do what he wants. I'm so glad that Congress is going to call him in and we'll ask some questions. I practiced pediatrics for more than 30 years, and I know that there's nothing I did as a pediatrician that had more proven value than making sure that my patients were vaccinated fully and on time. And he has done so much to undercut that, and it's making it so hard for parents, for adults, for anyone who wants to do the right thing for their health, because there's so much misinformation swirling out there.
Yeah, it goes well beyond the COVID vaccine. Dr. Richard Besser, thank you so much for joining us. Really good to have you.